Good afternoon and welcome to the webinar on how to develop a logic model. The official name of this training program is called Designing and Managing Programs: An Effectiveness-Based Approach. And the whole idea of creating effectiveness-based programs is really looking at programs that do what they say they're going to do and achieve some type of outcome and impact, as compared to an evidence-based program, which has been proven over time through research that it actually produces the results that it wants. Now, we can talk a little bit on a different day and talk about how do you get a program to become evidence-based if there's interest in doing it. But this basic program really talks about how to develop and implement a logic model and use it for your programs so that you can demonstrate that your programs are efficient and effective and produce the results that you want. For those of you who aren't familiar with Strategy Solutions, I'm Deb Thompson, the president of the company and the founder. We're celebrating our 20th anniversary this year, and the mission of our company is to create healthy communities. And the company was founded out of my work as a hospital planner. I often introduce myself as a recovering hospital planner. Please don't hold it against me. But I learned during the 10 years that I was the leader of the community health movement in Northwest Pennsylvania that hospitals alone were never going to solve the community health problems that we have, and that if we were going to create healthy communities, they were really going to be created through the intersection of supporting private sector wealth creators, because those companies are the ones that bring jobs and economic development. But a healthy community is also dependent on strong community infrastructure and government, things like workforce development, education, and economic development. And then also partnered in communities with that is a strong social services sector, which includes community and faith-based nonprofits as well as healthcare. And a lot of our work supporting organizations on a rent-a-planner basis started because our work really tried to create healthy communities. And we've been doing this work to support hospitals, health systems, and community agencies and organizations now for about 20 years. Now, as we begin to think about evaluation of any type of a program or measuring outcomes and impact, we always want to start with these basic questions, which are the foundation of our planning and evaluation process at Strategy Solutions. Where are we now? Where do we want to be? How are we going to get there? Who's going to do what? And how are we doing? And we do that through a process of how to develop and use logic models as part of that program planning process, to be able to measure the outcomes and impact associated with that program or an implementation strategy. So our objectives today are to give you some basic elements of how to do that, and then start to understand how to establish an evaluation process to evaluate the outcomes and impact of your implementation strategies. But I'm going to use this as an opportunity to do a little commercial for our upcoming webinar. On October 11th at 2 p.m. Eastern Time, we have a special program that drills down into how do you actually conduct a evaluation of your community health needs assessment implementation activities. I'm going to talk a little bit about the process today, because creating a logic model and using the logic model to measure outcomes and impacts is part of that evaluation process. But we have that separate program coming on October 11th that talks more about the specifics related to the evaluation itself. We also have an upcoming program on November 24th at 2 p.m. that is going to be all about automating your outcomes indicators and how to think about taking what when you do have an outcomes measurement and we have a piece of data that we have to collect, that how do we begin to automate that and make that part of our electronic record keeping in our organization. So we're going to talk about that specifically. But today our work is going to be really about the logic models. But I'm going to talk about it in the context of program evaluation, because a logic model is a tool, and it's a tool to help us make sure that our program design gets us to where we want it to be, and that the activities we're doing actually produce the outcomes that we want and the impact that we want, and the things that we're measuring actually tell us if our program is efficient, effective, and gets us the outcomes that we want. So it's all part of the same process. So I'll start with this discussion about program evaluation, because the evaluation process itself is the method for collecting and analyzing and using information to answer the questions about programs, particularly about their effectiveness and efficiency. So we do evaluation to say, are we getting the results we want? And we're creating logic models because the logic model is the best tool to make sure that we're actually measuring the right things as part of our evaluation. So why do we do program evaluation? There's lots of good reasons. Ensure transparency, measure outcomes, form the basis of future programming, inform those who are administering the program, providing information about what works and doesn't work and why. There's 3 types of evaluation, and data is collected of different types for different types of evaluation. We're going to get into these in detail in our next program. So you have the definitions here of the 3 different types. We're going to talk about them at our October 11th program in detail. And here's a little qualifier before I get into some of the details about how to create a logic model. First of all, and it's related to our philosophy, because Strategy Solutions really takes a balanced approach to program evaluation, because we balance practicality and the need to know with good applied science, and we balance that with proper methods, data collection, and analyses. Now, we could be very, very rigorous related to research, and if you're trying to prove evidence basis for your program, which most people aren't, we just want to know if it's doing what it says it's going to do and gives us a good outcome. You don't have to be as rigorous with your data collection methods or as precise, but you want them to be solid, you want them to be well done, and you want to be able to get good, reliable, and representative and valid data out of the work that you're doing. So we try to balance those things. So we don't really, we don't have, put a lot of effort into preciseness from a research perspective in general. But the exception to that is if somebody is attempting to prove evidence basis, then the methodology is going to be way more rigorous. But for the most part, we try to have good practical approaches that get us good results without spending a lot of time and putting a lot of resources into the measurement process itself. But one of the things that I guess I have to say out loud is if we're talking about measurement of outcomes and impact, some of the resources that we put into our implementation strategies really need to give us resources to do measurement, because oftentimes we think about measurement after the fact and we don't plan for resources. So our implementation strategies that we put together, there should be an objective on there that we're actually going to create good methods to measure the outcomes and impact and actually put some resources into that initiative as well. So there's 3 types of program evaluation methods typically. And once you get these labels and these definitions and start to understand what things fit into which bucket, measuring outcomes and impact is going to be a lot easier for you. And one of the things that I will get to you as part of the learning packet with this webinar is we have a really nice, it's sort of like a set of cheat sheets. It's how to develop logic models. It's a worksheet packet that we've put together that actually has a number of questions that you want to ask yourself if you're designing a program to come up with an effectiveness-based program and help you to develop your very first logic model as you get started. It also has a cheat sheet associated with it to help you figure out, well, is this item that I'm having here, is this process or an output measure? Is it an outcome, short, medium, or long term, or is it an impact, which is a long-term outcome? And I'll talk more about that in a few minutes, but we'll make those available to you as well. But generally speaking, the first type of item you get is an output measure or a process measure. And these measures are answering the question, are we reaching who we should reach? Are we reaching the target population? It could be the number of people reached. It could be the percentage of the population that you get. It includes program strengths and weaknesses, and it also includes feedback and satisfaction. Now, I will say at this point that you should write this down if you're taking notes. Client satisfaction or consumer satisfaction or patient satisfaction of a program is always an output measure. It's not an outcome measure. Many of us think it's an outcome, a short-term outcome. It's not, because satisfaction should be a given if the program is actually operating. It's really not an outcome of the program itself. So you always got to remind yourself of that. Now, short-term outcomes and sometimes medium-term outcomes are things that are related to knowledge, attitudes, behaviors, or other predetermined variables that changed as a result of the program. So those are outcomes. So if you're doing a training program and people now understand that nutrition is related to diabetes, and they learn that knowledge as part of your program, that's actually an outcome. That's a short-term outcome. If they decide, if they have intent to change their behavior as a result of the knowledge that you gave them, that is also a short-term outcome. So you can actually measure that in a survey. And one of the other tools that we'll give you with this webinar, in addition to my cheat sheet, a bunch of years ago we developed a template for prevention programs and community education, like a satisfaction survey at the end of a program. And the survey is designed to have questions on it where you can measure the knowledge learned or the intent to change behavior. The percentage of a program group that said that they're very likely to implement or change their behavior based on this knowledge, that's another short-term outcome. So these things that sound like, warm, fuzzy, and fluffy, they actually can be measured if you look at them that way. So we do have a tool that we've created that you can use the questions from. And then the impacts are the long-term changes that are a result of the change in the outcome variable. So in other words, if we get people to change their behavior, like do they eat healthier as a result of a cooking class, then over the long term, the impact should be that they're healthier or that they lose weight or some other long-term change. Their well-being is better. And I put a note on here because two things that are important. One is a lot of efforts now are targeted toward the AAA. Are we improving health status? Do we have good quality? Is there cost savings involved? Because a lot of the new impact questions are, how does the program save the system money? A lot of programs now are designed to actually reduce utilization or to save costs somewhere, improve quality of life. Is it doing that? So we want to make sure that we have some type of measures in our programs that give us data about those things. And we'll talk about how to do that as we move on. So what is a logic model? A logic model is a graphical representation of a program. And what it is, it's a series of if-then statements and a series of relationships that give you a program roadmap. And it really is a tool that is helpful to identify outcomes measures. It really is a helpful tool. Now, it's not this, okay? I love this cartoon. It says, good work, but we may need a few details right here, because in the middle we have this thing that says, we hope many miracles occur. That's what not to do. Now, here's an example of a basic logic model. Basic logic model starts with a condition that we want to change. So in this particular very simple example, we're hungry. That's a condition we want to change. The activity that we can do is we can get food. That's the activity. We're getting food. Now, a short-term outcome related to getting food is eating the food. That's actually an outcome of getting the food. We can then eat it, and then we feel better. That is an outcome. Feeling better because we've eaten when we're hungry is actually an outcome. It's the change that's a benefit because of what activity happened. So let's talk about, here's one of my cheat sheets on how to build a logic model. Logic models have 6 columns generally. Sometimes a logic model will have that condition on the far left-hand side, the condition we want to change, depending on the format you use. But we like to use this basic 6-column format. There's inputs, outputs, and outcomes. So the inputs are what we invest, and these are typically often the same. We're putting staff time in, we have volunteers, we're putting in dollars. There might be some research base that we're building on. I know lots of organizations use evidence-based programs, which might actually suggest what some of your outcomes measures are. But those might be the inputs. We have equipment and technology. Those are the things that help us deliver our programs. Now, the first type of output is our activities. It's what we do. Generally speaking, most programs include either training or teaching or some type of delivery of service or some type of activity. Those are the activities. And we also could have outputs depending on the kind of program we're running. And I have these sorted into, like at the top of the list are at an individual person level. And then the ones I have labeled at the bottom called macro are parts of the logic model that we might use in that particular column related to systems change initiatives. So from a macro perspective, we might have a program, and I'll give you an example, because we're working as the external evaluator of a high utilizer management program in Alaska. And that program is designed to address the social determinants of health of high utilizers of emergency department and inpatient services. A lot of the population being served has co-occurring behavioral health and substance abuse issues. And in addition to trying to provide the care management for the individual people and actually help them improve their personal well-being, there's a macro perspective to that program in that the program directors and managers and the collaborators that are working on that program are also trying to change how community agencies interface with one another. And they're also trying to impact public policy in the state of Alaska to make more services available to the communities there. So you might have activities happening on a macro level where you have the activities might have to do with creating a network or creating partnerships or assessing need or facilitating some type of systems change. Those might be the activities, which are, again, on a macro level. They're not on an individual person or program level. So logic models could be used for both, and I just wanted to point that out to you. So we're doing activities. That's the first output. The second output is who we reach. It's the participants, the clients or the customers, patients. And from a macro perspective, it could be decision makers, agencies, it could be politicians, the state legislature. But again, these are people who we reach. So satisfaction of a participant in a program is going to be an output. So you would include that in the logic model in that output column related to who we reach. Now, typically speaking, short-term outcomes, whether you're working on an individual or a macro basis, those short-term outcomes are generally related to learning, knowledge, awareness, attitudes, skill, opinions, aspirations, or intentions. So again, intent to change behavior becomes a short-term outcome. And I love these words because if this is what you're really trying to do, well, it's probably a short-term outcome related to that in your program. A medium-term outcome is generally the action itself or the behavior. I went to a diabetes program and I learned a little bit about nutrition. I learned how to cook nutritious foods. Did I actually take action and go home and actually make some of those foods? Now, implied in some of this, as we think about the actual measures themselves, we have to be thinking about how do we follow up with these people to actually find out if there are longer-term outcomes and impact. And that's part of the challenge with this effort and why we have a special program as part of this series where we talk about automating indicators. Because if you're in a hospital or a health system, you actually have more data available to you than you realize. But you have to think about where people are in the system and figure out how you're going to track people over time to get that data. So we have a special program devoted to that. But the action or the behavior is really what the medium-term outcomes are. And on a macro basis, it could be things like decision-making or changing policy or some type of social action. And over the long run, outcomes are related to changing conditions, improved health, well-being, and some, again, some improved state for the individual. And from a macro perspective, it could be a change in the environment, it could be a change in economics, or something civic in the particular community. This next slide is just another way of looking at process or output measures, outcomes, and impacts with some examples associated with it. So, process measures could be including the resources that you have available, the delivery itself. Sometimes, depending on what your implementation strategy is, you can only have a process measure that I did it by the date. Like, for example, if one of your implementation strategies is to build a cancer center building, well, your outcome is that the building's built. So it's a process measure, and that's okay. Or if part of your implementation strategy is to create a plan, it's a process measure that the plan was done by the due date. That's fine. It would also measure your target audience. Who's involved, what's working, what's not working related to program strengths and weaknesses, and it might also include some feedback. Outcomes include, like as I said earlier, knowledge, attitudes, behaviors. So, for example, understanding the relationship between diet, physical activity, and diabetes. That's an outcome. That's a short-term outcome. Empowerment and desire to change. All of those things are short-term outcomes. You might actually have, if you're, part of your effort is systems change, okay? This is like more on a macro basis. Revising a program strategy or reallocating resources within a community to address a need or a gap, that could actually be a short-term outcome of a macro implementation effort if what you're attempting to do is systems change in your community. You might also have, revised communication and updates to fundraising. Fundraising might actually be a short-term outcome for a program if you're trying to get something off the ground. And impacts are things like the decrease in cost associated with diabetes care. I've been using that a lot as an example, but what we found is that a lot of folks actually are doing diabetes education programs as implementation strategies. So you want to look at, is the program really making a difference? So that's a good measure. A decrease in hospitalization associated with diabetes is a good measure. And it doesn't have to be all of the people in your community. It doesn't have to be all of the people in your health system. You could be measuring the impact of the people who are participating in your program. And for a lot of your implementation strategies, that's the best way to think about it. You don't want to think about every person in the world with diabetes. You just want to think about, is the program that I'm doing effective for the people that I'm doing it for? And then can I leverage to get more people in it? So those are the kinds of impacts that you want to begin to think about. Now, this is a busy slide, but again, it's a tool to help give you an idea of what questions are being asked in each column of a logic model. Like in the beginning, this state, what are the needs that we want to address? The process evaluation includes things like, how's the program being implemented? Are we reaching the people we want to reach? What are their reactions? Are they satisfied or not? And you can see here this little purple oval up here. It's an output measure if people are satisfied. So participation and who we reach is an output measure. Our outcome and impact measure includes things like short-term and medium-term and long-term outcomes. Are we achieving the goals? Who's benefiting? How are they? Does it seem to work? Are there other things going on? This is just another way of sort of looking at outcomes and impact and what questions you want to ask yourself at each stage of the process. So as you think about those, if you think about each step of the logic model, you want to then be able to look at the pieces that you have related to the model itself and say, now how am I going to be measuring these things? This is the best tool that you can have for determining your outcomes measures, is to say, now how do I take this impact measure that I've identified here, and how do I actually create an indicator that would allow me to measure my outcome and then actually measure it. So again, it gives us that ability to say, okay, if the impacts that I want are decrease in cost associated with care, what are the activities that I want to do to make sure that I get there and ensure that I get the outcome that I want. And it really helps you think through all of the activities. And we've had situations where people have laid out the 5 columns of a logic model and then said to themselves, well, okay, we expect to have our clients have financial literacy by the end of the program, but we're not actually doing any activities that help the client improve their financial literacy. Maybe we need to think about and go back and look at our program activities and put activities in our program that help us get to that outcome. But again, this approach is very logical. All you have to do is answer the questions and fill in the blanks, and you should be able to outline your logic model for a particular program. And that then gives you the ability to say, okay, now here's the items that I want to measure for each of my indicators. It's really pretty simple. And if you follow the example, we'll give you the tool that we use to sort of lay each one out. It will help you with the preparation for you identifying your outcome and impact indicators. And then it's a matter of using that information that you have and setting up a program evaluation process, which is understanding the program, implementing continuous improvement, and putting together some evaluation methods. And what we have found is that if you develop a logic model for each of your programs and then you take your take the things that you have as part of your outcomes measures, and you sit down at a point in time, and this formal evaluation process is what our next webinar is about. We're going to be explaining how you take the data, turn it into indicators, and then start to pull it together either on a quarterly or an biannual or an annual basis. We recommend that you put it together at least once a year. We'll explain the process of doing that the next time around. And and with that, we can talk about questions. And I actually have a question in the chat feature that came in, is can you show us an example of a particular logic model? And I am looking, as we're talking about this, I'm looking for the example. And I'm thinking in retrospect, I should have put that example that I said we were going to put in our toolkit that we'll send to you. I actually should have put it in the webinar slide deck itself. I'll take a minute here and find that template for you and show you what it looks like as an example. Let's see here. Okay, I'll show you an example here. This is a program. I'll share my desktop with you so you can take a look at this as an example. This is actually an example of a logic model here for a psychiatric rehabilitation program, okay? This is a program that's targeted to individuals with severe mental illness. And the inputs aren't even filled out here because they're kind of givens. It's the staff time, it's the resources, it's the information put together. And what the organization does, they do group or mobile activities, they put together a recovery plan, they do strength-based assessments, they have individual progress notes, they work on achieving client recovery goals. Who they reach are the individuals that were referred from the health plan and individuals in the county with serious mental illness. Their short-term outcomes are the number and percentage who follow through and actually come to the program after intake. That's a short-term outcome. The number and percentage of people who complete the intake process. The number and percentage that complete a recovery plan and complete a RAP plan and actually come to the classes, okay? Knowledge of the topics taught in the groups are, again, short-term outcomes. Intermediate-term outcomes are things like the number and percentage that achieve the recovery goals, an increase in scores on a strength-based assessment. A lot of times programs, especially if you want to measure quality of life or something like that, you can look at pre- and post-test of the same questionnaire and look at the difference in scores. Another intermediate-term outcome is engagement in community activities other than the psych rehab program itself, and then demonstrating the competency of the knowledge in the topics taught. Long-term outcomes include things like their discharge to community supports, the individuals are utilizing community resources, they don't require a higher level of care, they've titrated services from group to mobile, so they're getting less of them, they've increased their well-being, and they've reduced their length of stay in the psych rehab program. So those are all possible long-term outcomes. And each one of these items here, whether it's a short, intermediate, or long-term outcome, has a associated number of, there's actually something that you can measure. There's a piece of data that you can measure as part of each of those. So that gives you an example of what that might look like. I will also unmute everybody on the phone in the event that there's any additional questions.
The conference has been unmuted.
Anyone else have any other questions? So I'm going to share this as well on my desktop and show you an example of the health fair evaluation questions that I spoke about earlier. Give some examples. You get a copy of this. I'm going to because I hear you get a copy of this. You can see this is a way of measuring. And we set this up to be an evaluation form for folks that have had, like, they'll get the same people that come back to health fairs year after year.
Can we mute the conference again?
Yeah, I think I'm going to have to. I have to go back to my screen. So I'm going to unshare.
The conference has been muted.
Okay, so now I can go back and look at this. Okay. I have way too many things open. Okay, so here's an example of taking a look at the items in a health fair themselves. Like, did you go back and make changes to your lifestyle as a result of what you learned at the event last year? If so, what did you do? So there's a way, if you get the same population coming to health fairs multiple times, it gives you an opportunity to go back and look at what did I learn from that. Or you can say, you know, how useful was the information presented today? Or the information received about community resources, okay? And then intent to change behavior. We have a section at the bottom, how likely are you to recommend the events to a friend or follow the guidance and advice that was presented today or follow up with your doctor or others for more information. That percentage of people that say very likely to change their behavior, again, that's a short-term outcome for your program. So these are examples of how you can use this information. And if you lay out the logic model, and part of what you're doing in your program is, you know, we want to measure the knowledge that people gain from our program. Well, we have to actually create a tool that allows us to measure that knowledge. So we'll talk more about in our next program how, actually in our third program, and the one we talk about automating indicators, we'll talk more on that third program about how to take the logic model elements and actually come up with a piece of data that measures it. But in the short run, and related to the logic model itself, the idea is to lay out the activities and what your goals are related to the program so that you can determine what it is that you want to actually measure over time. So really thinking through, you know, what is it that I want to see happen as a result of my efforts in this program, again, will help you eventually figure out what the outcomes indicators are that you'll want to have. But the logic model itself is pretty simple, and you'll see from the tool, you know, the little worksheet that we send you, that if you just follow the questions and answer the questions, that you should be able to develop a logic model for yourself as well.
The conference has been unmuted.
Any other questions?
The conference has been muted.
Okay, so with that said, I'm going to say thank you, everyone, for participating in today's webinar. And if you have any other questions or want any information, as I said, within the next day or so, Kathy from my staff will be sending out all of the information from this particular webinar, and we'll be giving you, those tools. And if you have any questions, we're happy to do a quick call with you, or if you have a program outline, or if you've put together a logic model and you say, I'm not sure if this is the way I do it, you can feel free to send it to me. I'm happy to give you some feedback on that or help you get started on doing your own. So thank you very much for your attendance and participation today, and we look forward to your participation in future webinars.